Welcome back. A new study shows less than 7% of adults are in good cardiometabolic health. But what does this mean and how is California doing? Cardiologist Dr. Ernst von Schwarz joins us now. Dr. von Schwarz is here to describe steps we can all take toward improving our overall health. So thank you so much for being here with us today. What is cardiometabolic health and disease?
Well, it's a conglomeration, if you wish, of different risk factors, Emily, which subsequently lead to heart diseases, atherosclerosis, problems in the brain and the kidney. So it's a classical risk factors which contain high blood pressure, hypertension, diabetes mellitus, obesity, metabolic syndrome, and a few others. So this study which you mentioned showed that, and you have seen it, of course, that less than 7% of adults in the US are really cardiac-wise healthy or vascular-wise healthy.
And so these conditions that are caused by maybe poor cardiometabolic health, can these conditions be prevented by our own behaviors?
In part, absolutely. So if you look, for example, more than 42% of people are obese in the United States. In California, we're a little better. It's approximately 30.3% of people who are obese or overweight. This is something which we can control with appropriate dietary measures and exercise. And obesity nowadays is clearly considered a risk factor for cardiovascular health. The next thing is hypertension, high blood pressure. So approximately 47% of adults in the United States suffer from high blood pressure. In California, it's less than 30%. So we are a little better here compared to the US national average. However, keep in mind that only 1 in 4 people with high blood pressure have that well under control. And uncontrolled blood pressure doesn't hurt. I don't know what my blood pressure is right now. You probably don't know what yours is, Emily, if you don't measure it now. So we don't have symptoms, and that makes it even more dangerous, because if it doesn't hurt, we don't take it serious enough. But it is serious, and we call it the silent killer.
And so we mentioned this study at the top of the segment. What does this latest study show?
Well, it shows basically that a large proportion of our population, among adults at least, has either risk factors for the development of cardiovascular disease, or they have been diagnosed already with cardiovascular disease. So the idea that we are healthier now than 20, 30 years ago is actually wrong. We have actually more risk factors now. People live longer nowadays than decades ago, but the longer life expectancy comes hand in hand with more development of cardiovascular problems, such as heart failure. People survive heart attacks, but then they develop weak hearts, or strokes, or dementia, which are all in part at least vascular diseases. And that will cause a major problem, not only economically in the future, but also for us as individuals. We might live longer, but not better.
Yeah, it's an interesting point. Health and, life are not exactly, they don't go hand in hand. It's a very interesting point. Okay, we mentioned California just a little bit. How does California stack up to the national averages when we're talking about cardiometabolic health?
Well, a little better, like I said, with regard to obesity, national average 42%, California 30%. With regard to diabetes, national, it's 11.3, California it's 10.5% right now. With regard to hypertension, 47 national versus 27.8%. So we are better than the national average, but not good enough. And the interesting thing is, if you look at different data now among young adolescents and children, the numbers of what we call pre-hypertension and pre-diabetes have gone significantly up. So 1 in 4 is basically pre-hypertensive or pre-diabetic among young adults nowadays.
Yes, I have heard that from many physicians and clinicians. So what are the most important things we can do to reduce our risk of developing these conditions?
Well, first of all, of course, control your weight. Overweight is bad, underweight is bad, normal weight is good. So if you're overweight, get on a diet right away and try to reach really a normal weight, because there's nothing good about overweight. It just causes too many issues down the road. Next, of course, have your blood pressure, your lipid levels, meaning cholesterol levels in particular, and your sugar levels checked on a regular basis, at least, even if you're a healthy young individual, at least once a year you should go to your doctor and have a general checkup and have those risks evaluated. And if, let's say, the sugars are high and the blood pressure is elevated, that does not always mean you have to take medications, but it does mean lifestyle changes, which includes diet, which includes exercise. The recommendation nowadays is 5 times a week, 30 minutes minimum of moderate intensity exercise for all of us adults. And that can include, of course, other things such as medications if indicated. But we have to take our risk factors serious enough, and we can do a lot without even just getting pills and medications, but the lifestyle changes are as important, if not more important.
I would think so too. This is all great information. Dr. von Schwarz, thank you so much for being here. We appreciate it.
Thanks for having me on, Emily.